Good afternoon. Welcome to this video, and it's going to be a topic about open enrollment for healthcare. It appears to me that maybe from my standard search in my Brave browser, uh, that it's about January 15th is the end. It could vary from state to state. I had another little app that it's kind of like a business app, and it said it had 3 days left, but that just might be for their little particular thing. So in general, I think you have a month left for open enrollment. Doesn't really matter to me. I'm have my situation all covered, and that's the point of this video. I'm gonna express why you should get out of your general healthcare provider plans and switch to crowd health, which is what I use. Only if you're healthy, though. That's kind of the gist of this, though. Is like I'm talking to people that are living a healthy lifestyle, eating well, nourishing their bodies. Uh, it's a whole thing. It's a whole different topic to get into, but um, you know who you are when I say that. People that do some fitness, at the very minimum, I'm doing my daily warm up routine in the morning to get my body right. I know I don't look that old. I get asked this a lot, how old I am. I'm not going to tell you today. It doesn't really matter. Just I'm much older than you probably think I am. But it's just a matter of taking care of yourself. Which I haven't always done, to be honest. But in other ways, I have done every single day also. So, I could just, you know, take care of yourself. That's it. You'll look alright. You'll feel alright as you age. Well, let's get back with the real message here. So it's critical to make the right choice for you and your family for 2026. The cost of living is destroying everybody. So you just gotta save where you can. Um, and this is definitely a huge way you can save money. The general search I've also had for collecting data points on the individual and the family for comes from 2019, 2020. So this is kind of the low end, being conservative here, and I'm sure that it's probably more expensive than what I'm saying for you or your family. So the individual looked like $4,500 per year. The family for a little over $16,000 per year. So it's quite a hefty burden to carry for yourself or a family. Um, Again, this really only pertains to people that are actively being healthy. So why you should switch to crowd health today. Like that's the point of this video. That's what we use. It's a crowd sharing program uh, for healthy people. So you don't people aren't going to the hospital, doctors as much as the normal 2/3 of society that lives in the sick care system, or I like to call it the death care system, where they perpetually keep you sick and drugged up and coming back around the full circle all the time. So you should get out of that. You should really be healthy and get out of that system and join the parallel economy and a decentralized life. It's definitely if you don't know anything about it, do your best to do some homework and figure out what those terms even mean and how to apply it to your life. But that's again a different topic. So let's get back to the healthcare here. They have two plans. There's the original plan, which we're on, and they also have a new one called the Black Swan plan. And the original plan, they're increasing it by $5 this next year, but $5, whatever, So the original plan for an individual, would be about $2,400 max. So that's like, if we're going off of the data points I told you earlier, for the individual, you're saving about $2,000 per year. For a family of four, $7,680 max, and this is adjusted for the new $5 increase. So it's about 8,000 and some change in savings per year for the family of four. For 55-year-old or over, it's about 4,000, a little over $4,000 max. And what I'm saying max is like, if the crowd is not having so many doctor bills or whatever, so many injuries, there's a lot of months where we don't even pay the full amount that's required. You're only really pitching in the max when everyone stubs their toe. You know, like, it's obviously worse than stubbing the toe because it's a healthy community. But it's kind of funny. I'm wearing the shirt, I guess. Sweat dries, blood clots, bones heal. That's kind of probably the mentality of a lot of the crowd health participants. So, when there's low volume of health needs, we do not pay the max. There's more savings as long as our member is intentional with their personal decisions, responsible members of society and taking care of themselves and their families. There's $500 per event. Then the crowd jumps in and helps you. So I think this is the deductible. I should know all these terms, I guess, but I'm just doing life, and my wife is the life admin for us. So if I'm wrong on this term, I think that's the deductible. But you pay $500 for the event. You break your arm, $500. The crowd pays for the rest, right? There's a full spectrum coverage in the original plan. So there's bill negotiations. Don't pay until the company negotiates, because they'll negotiate on your behalf and lower the cost for you and for everybody in the crowd. Annual wellness checks, quarterly specials. I'll talk a little bit more about that soon. Maternity support, and more. You'll just have to go to the website and see all what's detailed in the package. The Black Swan, which is new, it's for like the super healthy / cheapest option. It's only covering like devastating events. Like if you're young and join this program and you take great care of yourself and you're just like, I don't want to pay that much money for anything, and unless I had a devastating car accident or some weird cancer, not because you took a vaccine though, right? Just more natural, I guess. Those kind of events. So like for the individual on that, you're looking at $1,200 per year. So it's half the cost of the original. The family, $4,320 per year. 55 and up, $1,680 per year. Yeah, I mean, you're just slashing the bill in half, basically. So even more savings per year for you. You only get the standard system though, so you get the crowd paying for events when they happen, the negotiation, the advocate, everybody gets the advocate, and that's great. The advocate's awesome. They help you find docs, prescription discounts. I think that's the only things you get, but again, just look on the website for yourself. If you want to get pregnant and you're healthy, this is definitely the way to go. It's only $3,000 in cost to you that you're going to incur, and then the crowd covers the rest. So we've done this twice now. So my wife's going to pop out her second baby here pretty soon, and I don't know, around Christmas time to in the middle of January, probably sooner than later. But you want to sign up. If you're trying to get pregnant, sign up before the event occurs, before you have that first diagnosis or noticeable, someone wrote it on a slip somewhere that you're pregnant, you know? Before you get your pee strip done, sign up for this, because if you only want to pay $3,000 for your child to be born, then this is the way to go. You're gonna save thousands of dollars for having a baby, and the typical stats I found was like $14,000, $20,000, covering prenatal care, birth, and postpartum care. That's like normal people doing all the normal things, listening to every single thing that the death care, sick care system tells you. Um, hospital fees and all that stuff too. We done it at home for our first child, and we couldn't have asked for a better situation. We were gonna do it in a hospital with a doula as our advocate to help us out, and they do cover doulas. CrowdOut does, but maybe another story for another day. But we ended up doing it at home, and we're gonna do it at home again, and this time we're much more prepared for the event, and you're gonna save a lot of money for yourself and the crowd if you just do it at home and with a midwife. And there's a lot of different ways to do a pregnancy, and you don't have to listen to every single horror story that your mom, your grandma, your sister, your cousin, your friend, your coworkers are all going to tell you, like, it's the worst thing ever, blah blah. Like, they all have some stupid story, and really just gotta drown it out. And when you're not the other, and just do it your way. There's a better way of doing this. Okay. So reasons to switch: the cost alone is worth the switch. Pregnancy is a bonus. Your care advocate is great, so each person gets an advocate, and we've been through 3 or 4 of them, but every single one has been awesome, and I think they've just got promoted within the company, and they tend to your personal situation, and they fight for you. And so there's been a few different situations, but the most recent one was they offer quarterly specials to, hold on guys, I'm still getting over some weird sickness. Little green tea. They have quarterly specials, and if you could prove that you're as healthy as you say you are, we did some labs, and I passed flying colors, and my wife, she probably would have, but did not because she's pregnant. So it skewed the labs, and we said, well, we would still like to save money next year, and this pregnancy kind of changed things up a little bit. Like, can we just take the labs later? And waited a couple months, and I'm sure there's a lot of people that ran into the same issue, and the company made a quick decision that they are going to extend it for people that are in a pregnancy event. And so my wife will take labs again after the pregnancy, maybe a month later, 2 months later, and I'm sure she'll pass the flying colors too, and then we'll save a bunch of money next year. So there's really cool ways to save even more money than what you're already saving. There's no restrictions on healthcare provider. You can still do the old system stuff, and they'll help you through that avenue. There's naturopaths out there. Just gotta know how to find them. Self-care. There's a lot of really cool things that we've learned in our lives that we apply. There's a really cool AI engine. Another topic for another day, but it's called Enoch, and it'll be changed. The name will change pretty soon, but basically, it's been trained on like millions of PDFs, documents, studies, thousands of books on everything health related. So doctors and nutritionists are almost irrelevant through AI now. Uh, but specifically with this Enoch AI engine, because it was trained specifically in health and wellness and a few other categories, but mostly health and wellness. So if you want to plug in a few ingredients that you have and say make a recipe, it'll do it in 3 seconds. I'm not spending too much time on this because it's a whole different topic, and it's going to change humanity for the positive if you understand it and how to prompt it and use it as a tool in your life. So self-care is huge in this realm of ours. I've had a direct primary care doctor, and the system is much better than the normal traditional system, but I'm more interested in naturopaths, but I'm mostly just self-care. I've done mostly self-care the last decade, maybe more. Communication is great, even as they're scaling. There's some small delays, but it's understandable because they're gaining more members because it's such a great program. And this is why I'm advocating for it, and we have an affiliate for it. Reimbursements are timely, so it's like you pay for the thing up front, whatever these events are, and then you will get reimbursed the money. And again, even though they're scaling and getting lots of members and they're slightly behind right now, you still get your money back really fast. So the system has worked for us for several years, and I wouldn't want to do anything else at this point. So if big pharma, hospitals, insurance brands, they're not loyal to you or helpful, really. Do you really understand their motivations? People that are healthy generally do, and that's kind of the point here. If you understand the motivations and choose to buck the system and do your own thing, this is the way to go. If you're healthy and plan to stay that way, you can get a giant victory today. We all kind of need one. And if you're not healthy and you're watching this video, get healthy. Take steps. Follow our channels to be slightly better. Channel, wherever you're viewing this on. And subscribe and sign up and do all those cool things, whatever. And, we're just going to give you all the tools and services and products that are going to get you there, so where you can sign up for this program. Unfortunately, 2/3 of America is basically obese. It used to be a third was overweight, a third was obese, a third was healthy, and it's looking like 2/3 is obese, and most of the other third is eating processed foods and stuff. So if you can navigate not doing all those things, this is going to help your wallet. It's going to help your life. So use our code here. It's M2FTAM. You will pay $99 for the first 3 months. After that, you'll have to pay the regular fees, whether you're on the original membership or the Black Swan membership. Use our code. You win. We win. We get some benefit from it as well after you stay on for 3 months. Once you start, I can't imagine you really leaving, because the system's 1,000. It's a million times better. It's infinity better. I think as long as you understand all these concepts, whatever, of being healthy and how to save money, if you want those things, you'll stay on. And then also, Crowd Health wins, obviously, they're a company, so everybody kind of wins. So 360 win, all goes around. So take control today. Come enter the parallel economy. Live a decentralized life. Be healthy. You'll be happier with money in your pocket. Pay off your debt. Invest in gold and silver. Crypto. Whatever fancies you. Start winning today. Again, use the code M2FTAM. Again, M2FTAM. M as in mother. 2, which is a number. F as in fart. T as in Tim. A as in apple. M as in Mary. That's the code. Start winning today. Sign up for Crowd Health. Sign up for our channel we're reviewing this on, or subscribe to our website, and we'll just give you all the cool tools that you'll need to succeed in life and move through the universe as the great taking happens, the great reset happens, all the fun things that humanity will see come crashing down. So where there'll be a shortage of many things, there'll also be abundance. And you'll also need to know where to save. So you can save money and also live a better life and be healthier with Crowd Health. So join today, and we'll see you later.